Hello, my name is Dr. Dawn Siegel, and I'm a pediatric dermatologist at the Children's Hospital of Wisconsin and Medical College of Wisconsin. I'm the co-director of the PHACE Syndrome Clinical Registry and Genetic Repository. Today I'll be telling you a little bit about the work that we've been doing to understand the cause of PHACE syndrome. The registry was first established in 2006 at the University of California, San Francisco with Dr. Ilona Frieden. We then merged the registry with the Texas Children's Registry run by Denise Metry in 2011. We currently have over 230 individuals with PHACE enrolled in the registry. Our efforts are to understand the long-term natural history of PHACE syndrome and also to identify a genetic cause. We believe that the repeated patterns of the hemangiomas, the blood vessels, and the structural anomalies of the heart and brain must not all happen by chance, but there must be a common underlying genetic cause. PHACE doesn't just happen with hemangiomas located on the face. We now understand that the hemangiomas may be located on the scalp, the body, the arms, or the legs. In fact, some kids with PHACE may not even have a hemangioma at all. And despite having, we next went on to look at the inheritance of PHACE syndrome. Despite having over 230 individuals in the registry, there has been no recurrence in families. So PHACE has never been passed on from a mother or father to a child, and there have not been families with two siblings affected. In fact, we know of two sets of identical twins with only one twin affected, and several sets of fraternal twins with only one twin affected. Therefore, we state that all cases to date of PHACE syndrome have been sporadic. We do know that PHACE is much more common in girls than in boys. In original studies, it looked like the ratio might be 6 girls for every 1 boy. Now with the larger numbers in the registry, it looks like it's closer to 4 girls for every 1 boy. We also did a study to determine if PHACE was more severe in either boys or in girls. However, in this study, we found that it's pretty similar between boys and girls. There were no significant differences in the findings in boys versus girls. The next step we went on to was to look at the DNA, or all the chromosomes, to determine if there might be areas of the chromosomes that were duplicated or lost in kids with PHACE syndrome. However, we did not find any repeated patterns to suggest that that was the cause of PHACE syndrome. Currently, we're working on looking at all the DNA to determine if small changes might cause PHACE syndrome. This is called whole exome sequencing. We're looking to see if a very small change might cause a protein not to work as well, and that would result in the things that we see in PHACE syndrome. We've done analysis on 24 blood samples from families and 16 tissue samples to see if we might find changes in any of those. This analysis is still ongoing. Most recently, we've also been looking at risk factors, environmental risk factors for PHACE syndrome. We started by looking at prenatal risk factors to see if there were any certain exposures or things that happened during pregnancy that might have caused PHACE syndrome. We found a slightly higher rate of preeclampsia and placenta previa when compared with the general population. However, we've also seen that preeclampsia and placenta previa are slightly higher in the mothers of children with hemangiomas. So we're not sure if what we're seeing here is related to the hemangioma or is related to PHACE syndrome. We did not see any significant differences in prenatal risk factors between boys with FACE and girls with FACE. We also wondered if more kids with FACE were born at a certain time of year. However, we did not find any seasonal variation in children being born with FACE syndrome. We also looked to see if there were any exposures that might be related to FACE syndrome, but we did not find any patterns related to infections, medications, alcohol consumption, or other prenatal exposures. So I'd like to take a moment to thank everybody who's enrolled in the registry. All of this work could not be done without you. And as you can see, we still have a lot more work to do, but we're going to continue doing more studies. And if you would like to join the registry, our consent process is now online at the Children's Hospital of Wisconsin website, as you can see here. I would like to thank all of the many funding agencies who made this work possible, including the National Institute of Health, the NIAMS branch, as well as the support groups, the FACE Syndrome community, and the FACE Foundation Canada. And thank you to the many others who have supported this work. Thank you.